Okay, Charlotte, so now that I've asked you quite a lot of questions about your breathing, you've told me that you've got a cough and sometimes you wake up at night and sometimes the cough is a little bit troublesome when you're doing the dancing on a Saturday. So what I'm going to do is a breathing test with you today, and this is called a pheno test. So it's quite easy to do, and I'm going to talk you all the way through it, and it's going to involve you doing a little bit of breathing in and then some breathing out as well. So in order to help you, when we're actually doing the test, you're going to see a picture on the screen. So I'm going to show you that first of all, and what you will see is a picture of a little girl holding onto a balloon. So when I ask you to take a breath in, she'll rise up into the sky on here, and then you're going to blow out nice and steadily for me. And the idea is that you're going to keep her balance between those two white lines on the screen. So I'm just going to show you what that looks like. So you can see her moving across the sky there. So as you're blowing and blowing and blowing, that's what you'll see her doing. Do you think that's okay? Fantastic. Okay. So there's 3 parts to the test that we're going to do. So I'm going to take this off here and take that plastic cap off. And this is a brand new mouthpiece now for you. And we're going to pop that on the top. So I'm going to ask you to hold on to that for me. So there's 3 parts to the test, as I say. First thing I'm going to ask you to do is just breathe out for me in a minute. So just blow the air out of your lungs. I'm now going to ask you to pop that in your mouth and take a big breath in, all the way in. Lovely. And when you're ready, start to blow. And then we're blowing that little girl across the sky. That's absolutely fantastic. Well done. Spot on. Keep going, keep going. And you've got to the end. Well done. That's absolutely lovely. So we'll put that on there. Now we can see a countdown. That's going to take just over a minute, and then we're going to get a number on the screen. And then we'll look at the number and we'll decide what's actually going on in those breathing tubes, and it will help me decide whether or not you need to go on an inhaler or what sort of treatment, because we've got to try and give you some help and get rid of that cough. So I just wanted to ask you, when you did the test, did you think it was easy or hard or in the middle?
It's quite easy.
Was it? Oh, that's good. And I think you did an absolutely brilliant job. So when we get your number, we're going to have a look at this chart. And as I say, that's going to help me really make the most of the decision we need to make in order to get you on the right treatment. Now, because of your age, what I'm looking for is a number on here in a minute that's less than 20. If it's more than 20, then we know we're going to give you a treatment with an inhaler. Okay, so we've got a couple more seconds to go, and there we go. So what we can see, Charlotte, here is your number is 30. That's telling me that inside your breathing tubes, they're a little bit red at the moment, a little bit angry. So we've got to get some medicine down there to settle all that down. So I'm going to now, the next step will be to show you some different inhalers and see which one is going to be the best for you. I'll give you that to take away and then ask you to come back and see me in a few weeks and see how you're getting on. Is that okay?
Yes.
Lovely. Well done. Thank you.